And take a look at the state as far as COVID-19 is concerned after we come out of the holiday weekend. With the last 24 hours, we have seen an increase of 439 new cases of the virus in the state. That brings the total number of active cases to 6,127 in Arkansas. 337 people are now hospitalized. 81 are on ventilators. And we've learned of 5 additional deaths today, bringing that total now to 292.
And the governor wants to dramatically increase both testing and contact tracing this month. Our Jay Burr joins us now live from the Capitol with more on how the state plans to do that. Jay?
Yeah, guys, exactly that. Governor Asa Hutchinson wants to get a handle on this pandemic, so it's contact tracing and it's also testing. But he also says that Arkansans need to be mindful of those social guidelines still.
Is about individuals taking responsibility.
Governor Hutchinson emphasizing that Arkansans have a role to play when it comes to getting Arkansas's COVID-19 numbers back in order.
What everybody can do is to help protect from their personal responsibility the spread of the virus.
The state will add 350 contact tracers, which will double the amount of tracers to the tune of a $20 million contract. Health officials say this will speed up the process of tracking the spread. Arkansans have another role to play here. Answering the phone.
It's really helpful for us when people answer on the first ring. This is something that we've encountered, our contact tracers having to call multiple times.
Another issue is testing. Governor Hutchinson was part of a call with the vice president Monday to voice concerns about the nation's supply chain for testing supplies.
It's not just about Arkansas, it's also about Texas and California and Florida, Arizona, all adding to that mix and putting pressure on the supply chain.
Department of Health and hospital labs use different reagents for their machinery, but that issue is there for them also.
I believe this is mostly just plain supply and demand, but we need to make sure these supply chain issues are solved for our commercial labs and also for our hospital labs.
Now, Dr. Smith also adding that that concern for Central Arkansas he had just a couple of weeks ago is starting to come to fruition. We're starting to see a lot more spread here. Now, it's not the same as what officials saw in Northwest Arkansas, where you saw some of that cluster spread, and then also, too, in some of those factory type of settings. Here, he says, down here in the central region of the state, we're seeing more community-wide spread type of spread of this virus here. But he says it's something that they will certainly continue to monitor. And again, he does emphasize that if you do go out, make sure to take those proper precautions. Live from the state capitol, Jay Burt, KRK 4 News.